Hello, today I'm going to be talking about a presentation that I've put together. So my name is Solomon Umeza, and today I will talk on developing workplace communication strategies. So that is the name of this particular unit that I'm about to present on. So as part of my presentation, I'm going to be talking about an organization that I work for. So it's called the Wings Wellbeing Center. So the Wings Wellbeing Center is a social and community support services. They really major in supporting accommodation and they support coordination. So clients in this particular in our establishments are supported in accommodation with staff who are always readily available to assist them in their daily living and well-being. And they also help them to participate in various aspects of our community services. So today I'm going to be giving an overview of a communication plan. So the plan has already been developed with the board and the management and staff to ensure that all the clients are kept safe and the staff are aware of their responsibilities to the clients and to the organization. So today I'm going to also look at the relevant legislation and policies. So in the policy aspect of it, we have privacy and confidentiality. So this means that we respect the privacy of all our service users. We ensure that we also keep their confidentiality and only ensure that their private matters are only shared with those who are directly involved with them. So we have also collection and the storage of information. So any information that we collect from any of our clients are always ensured that we store them appropriately, case by case and files by files. And the next policy is Age Discrimination Act of 2004. Racial discrimination is also one of the policy. Sex Discrimination Act, Disability Discrimination Act 1992, Fair Work Act 2009, Workers' Compensation Act 1987, Association and Corporation Act of 2009. So today, the plan of the communication plan and strategies that we have in place is one, we've got telephone numbers for emergency services. We've also got telephone numbers for management. And we have a list of emergencies, for example, when we have fires, trips and fall, violent acts, lockdown. And we have the list of stakeholders. We have time frames. And what if any special requirements there are? Also laws and policies that we have to follow in our organization. So today I've actually developed a crisis and communication plan for any of our clients who might have any injury or be involved in any crisis that might occur at any time in our workplace. So I'm going to be looking at how is this communicated. So for example, when there's fire, how is it going to be communicated to all our residents to ensure that no one is left behind in a fire situation? So in place, we have the fire alarm or siren. We have the voice of a person to the other person. And also there are also special needs and requirements. So these special needs and requirements are for those who are physically impaired, who have hearing impairments, where we can use sign language to communicate the situation to them, where we can use whiteboard, telephone, and making sure that we are helping to keep notes at every given time. So we also have the stakeholders. We have the board, the client, the staff, their relatives. So we communicate all this to all these people that are listed there. We communicate to the fire department, the ambulance, hospital, and police if it is quite necessary to do that. So in doing that, there is also a bit of a time frame that we have to follow. So immediate and first clients are the first people that we have to look out for. So after we've looked at the immediate client, we now look at the immediate staff, and then the immediate management, and then immediately the ambulance. So when we get the ambulance in, then we immediately contact the relative. So when all the clients are moved to a safety place within 1 hour. So when this crisis happens, there's fire, these are the procedures that we have to go through to ensure that the clients are safe, to ensure that they are put in a reasonable place and the ambulance have been called within 1 hour of the time that this fire occurs. So when we talk about these strategies of communication plans, we have laws, standard, and ethics. We have in this standards, we have law age, we have racial, sex, and disability discrimination act, privacy and confidentiality, the duty of care, and informed consent. So these all together forms a whole basics for our communication plan when we are in crisis. So this guides our work, what we do, and it helps us to be able to know how we communicate in times of crisis to our residents, to all the staff that are present in our place of work, the management at large, the relatives of our clients. And with all this in place, we'll be able to manage any crisis that happens in our well-being center. So well-being center, as I mentioned from the beginning, is a place that will have a social and community support service for all those people who are living with different kinds of disability. We also support accommodation plan for those who are homeless, and through that we support the coordination of them all. And that is why having this plan, this crisis plan in place for all our clients is very, very important, because with this, we will be able to come to the need and the aid of our client in times of crisis. So this will help us to better improve our services that we render to the general public. So this crisis plan will therefore help us to enhance a better service and will help us to be more effective in our center, because the people that are there need our support, they need our help.